Hi everyone, if you are a regular viewer of my channel, then you would know that these days I'm covering the basics of Squint. And yes, this is yet another video on Squint. In case you are new to my channel, I welcome you here. I'm Dr. Babita, and in this video we will discuss the laws of ocular motility, Herrings Law of equal innovation and Sherrington's Law of reciprocal innovation. Let's start with Herrings Law first. Herrings Law states that during conjugate eye movements. Now, what are conjugate eye movements? Conjugate eye movements are when both the eyes move together in the same direction. So, during conjugate eye movements, the brain sends equal and simultaneous innervation to the yoke muscles of each eye. So, what are yoke muscles? Yoke refers to this wooden thing that is placed on the necks of two animals so that they move together. So, when one ox moves, the other ox also has to move. Similarly, two muscles are called yoke muscles when during an ocular movement, when one muscle contracts, another muscle, which is its yoke muscle in the opposite eye, that has to contract as well. Let's take the example of dextroversion. Dextroversion is a binocular eye movement in which both the eyes look to the right. Suppose I place a pen in the field of vision of this patient's right eye and ask him to look at it. So to look at this pen, the patient will have to abduct his right eye, and abduction is the primary action of the lateral rectus muscle. So the brain sends stimulus to the right eye's lateral rectus muscle to contract and the eye abducts. But at the same time, we see that the left eye looks in the right direction as well, even though this pen is not in the field of vision of the left eye. This happens because the right eye lateral rectus and the left eye medial rectus, they are yoke muscles of each other. And according to Herrings' law of equal innervation, when one muscle contracts, the brain sends equal and simultaneous innervation to its yoke muscle in the opposite eye, causing both of them to contract at the same time and by an equal amount. This law is applicable in all the 6 cardinal positions of gaze. So when the right superior rectus contracts, left inferior oblique contracts too. Left superior rectus contracts with right eye inferior oblique. Left lateral rectus contracts with right eye's medial rectus. Right superior oblique and left inferior rectus contract together. And right inferior rectus and left superior oblique also contract at the same time. These pair of muscles are yoke muscles of each other. Therefore, the yoke muscle of medial rectus is lateral rectus of the opposite eye. Superior rectus and inferior oblique are yoke muscles of each other, and the third pair of yoke muscles is superior oblique of one eye and inferior rectus of the opposite eye. Yoke muscles are also known as synergists or agonists. So, is there any condition that violates Herrings' law of equal innovation? Means any condition in which this law is not followed? So, Herrings' law of equal innovation is not followed by dissociated deviations. In fact, the reason why these movements are called dissociated, it is because these movements are not associated with simultaneous movement of the opposite eye. For example, suppose this patient has a right-sided dissociated vertical deviation. I have covered this eye with my occluder, and now when I remove this occluder, I see this eye coming from up to down. Let's see this again. I cover the eye. When I remove the cover, I see it coming down. But when I observe the other eye for simultaneous movement, where I would expect it to move in the downward direction at the same time, I don't see any movement at all. Let's see once again. The right eye is coming down, no movement in the left eye. So this here is the Herrings' law of equal innovation getting violated. Now let's talk about Sherrington's law of reciprocal innovation. We just learned that Herrings' law deals with yoke muscles or what we call agonists. Sherrington's law deals with antagonists. Antagonists refer to a pair of muscles in the same eye whose direction of action is opposite to each other. Means they contract to pull the eye in opposite directions. For example, medial rectus adducts the eye, so its antagonist would be the muscle that abducts the eye. So the antagonist of right eye medial rectus would be right eye lateral rectus. Similarly, superior rectus and inferior rectus are each other's antagonists, and superior oblique and inferior oblique are another pair of antagonists. In the resting position, that is when the eyes are in the primary position, it is not that our extraocular muscles are completely relaxed. They have an inherent tone that we call the resting tone of a muscle. Now suppose the right eye has to move to the right. To make that movement possible, our brain sends stimulus to the right lateral rectus to contract. And to make that movement smooth, it also sends stimulus to its antagonist to relax. Thus, when this eye goes into abduction, the right lateral rectus contracts and the right medial rectus relaxes. This is Sherrington's law of reciprocal innervation, which states that increased innervation to one muscle is accompanied by decreased innervation to its antagonist muscle in the same eye. So let's see how these two laws of ocular motility, the Herrings Law and the Sherrington's Law, are obeyed in any cardinal position of gaze. For example, when the eyes move in levoversion, that is both the eyes look to the left side, the left eye has to abduct and the right eye has to adduct. So the brain sends signal to the left lateral rectus to contract. At the same time, following the Sherrington's law of reciprocal innervation, the brain also sends signal to the left medial rectus to relax. And again, at the same time, the brain sends signal to the yoke muscle of the left lateral rectus, which is the medial rectus of the right eye, to contract. This is by Herrings' law of equal innervation. And when the right medial rectus receives the signal to contract, the right lateral rectus is instructed to relax because of Sherrington's law of reciprocal innervation. So is there any condition in which the Sherrington's law is violated? Yes, and that condition is known as Duane syndrome. Some people call it Duane syndrome, some people call it Duane's syndrome. So what happens in a normal situation when an eye adducts? So when this eye adducts, the brain sends stimulus to the right medial rectus to contract, and by Sherrington's law of reciprocal innervation, it sends signal to the right lateral rectus to relax. What happens in Duane syndrome type 1 is that when the medial rectus of the affected eye contracts, its lateral rectus, instead of relaxing, it contracts as well, along with the contraction of the medial rectus. Now, why does that happen? Duane's retraction syndrome is a congenital condition in which the sixth nerve nucleus is absent in the brain. As we all know, sixth nerve is the abducens nerve, which innervates the lateral rectus muscle. In Duane's retraction syndrome, the lateral rectus muscle is not innervated by the sixth nerve. Instead, it is innervated by a branch of the third cranial nerve. This is an anomalous innervation. And this same third cranial nerve normally supplies the medial rectus as well. Therefore, during adduction, when the brain sends signal to the medial rectus to contract via the third nerve, the same signal also reaches the lateral rectus to contract because both of them are innervated by the same nerve, and therefore both of them contract simultaneously. This is known as co-contraction of muscles, and it is evident as retraction of the globe, which is seen on adduction, and that is a characteristic feature of Duane syndrome. So this is how the Sherrington's law is violated in Duane's retraction syndrome, because the antagonists are contracting together. So I hope these laws that govern ocular motility are now clear to you. Please like and share this video with your friends and colleagues if you found it useful, and please subscribe to my channel to support free education. Thank you very much.